Commit to cattle pregnancy testing, there's a few logistical issues, namely cow and human safety, and the legal lowdown on who can actually pregnancy test in Western Australia that need to be firstly addressed. So firstly, what pregnancy testing options are actually out there? Most producers are familiar with the manual rectal palpation method in cattle, which is essentially exactly what it sounds like. An operator places their arm up through the rectum to palpate the reproductive tract and uterus and figure out what stage of pregnancy that cow is in. More commonly used now, ultrasound, either transrectal or transabdominal, is used to not only determine pregnancy, but also more accurately determine pregnancy status, i.e. what trimester of pregnancy that cow is in. Blood, milk, and urine sampling options are also available, but are not necessarily the most feasible or logistically possible options for most producers. Newer technology like accelerometer collars and breath metabolite analysis are now also becoming available, more commonly used in more intensive systems, but currently are not as accurate as either manual rectal palpation or the ultrasound method. For cattle in later stage of pregnancy, you may be able to visually assess whether that animal is pregnant or not, but this is generally not recommended because for obvious reasons, it's not quite as accurate as either our ultrasound or rectal palpation. So who legally can actually pregnancy test in Western Australia? Pregnancy testing in cattle under veterinary practice regulations is still an act of veterinary service. And this means that only registered veterinarians are actually able to perform this and receive a fee. The exemptions to this are if you're pregnancy testing your own cattle or if you're an authorised person under veterinary law. Now, these authorised people are generally non-veterinarians that have been approved and registered with the Veterinary Practice Board in Western Australia. This often requires doing a certain number of hours with a registered vet to train up in the practice that you would like to perform. These people are allowed to diagnose pregnancies in cattle and to charge for their services. Remember that diagnosis and treatment of disease is strictly a veterinary service. Only registered veterinarians can legally diagnose diseases. Any suspected abnormalities or diseases should be documented and referred to local or state veterinarians. Cow safety is of the utmost importance in pregnancy testing, and this is a particular risk when using ultrasound. Rectal perforation by the ultrasound introducer arm and probe is the biggest risk to the cow when pregnancy testing via the rectum. These rectal perforations or rectal tears are fatal to the cow, and there are no practical treatment options that can be used to save these animals. So we really need to focus on prevention to make sure that this doesn't happen in the first place. Signs that your cow may have a rectal perforation include rapid lethargy or sickness, bloating, and death within 48 hours of pregnancy testing. Typically, a lot of these signs actually appear within the first 12 hours, so it's fairly indicative that something's gone wrong. So preventing rectal tears essentially comes down to adequate restraint of the cow and how you're moving when scanning. Cows should be adequately restrained, which means not squeezing too tight in the crotch and reducing the amount of room for that animal to launch forward. This back and forth movement rather than side to side is the number one cause of these rectal tears. Keeping cattle out of the head bale may also avoid them going down on their knees, which can help you control the angle of that introducer arm or probe. Keeping one hand on the tail and the other on the probe and moving with the cow is a very useful way in preventing these rectal tears. It helps minimize any sharp or sudden movements of the introducer arm by buffering that movement with your body. A lubricant should be used every cow every time the cow comes through. This is typically placed in a pot or jar next to the scanning person so that this can be dipped in and out between cattle. Many lubricants are commercially available, including methylcellulose powder, which can be made up fresh on the day of testing. It's important not to leave lubricants in hot cars or in the sun because this can break down the components and reduce the ability of that substance to lubricate. It's best to make up lubricants fresh for each herd tested for the best consistency. Importantly, you should never force your arm if using rectal palpation or probe or introduce the arm past a rectal contraction. Forcing past these rectal contractions is a big risk for creating rectal tears, and it is much better to wait for the contraction to pass before continuing to scan. Human safety is also an important factor. If you're scanning through a crush, it's important to check that you've got a safe head bale, kick gate, and a vet access door can help with access to the back of the cow. Check your rollers before use, oil up anything that's not moving smoothly, and make sure to do a full check of the crush and surrounding gated equipment before starting your scanning.